Hi, I'm Dr. Castanet. I'm going to explain to you the cause of neck and back pain. It's real simple. It doesn't follow the typical paradigm of medicine or chiropractic or physical therapy. It's a rather unique perspective, but it's solid, it's logical, it's intuitive, and I think you'll find it credible. Here's what happens. Over the course of our lifetimes, from the time we're small, as kids and as teenagers, we start to acquire degenerative changes to the discs that are between the vertebrae of the spine. I'm going to use a model to illustrate this. This is supposed to be a model of a normal vertebral structure. Actually, let me grab another model here instead. This is supposed to be a model of a normal two vertebrae in the low back area. What I explain about the low back is going to be largely true of the neck as well. These are discs in between the vertebrae, here and here. The spinal discs are made up of 12 to 25 tough, fibrous connective tissue layers. They are around the outer part. The inner part has a different consistency, kind of more like crab meat. It absorbs water, imbibes water during the nighttime when we're asleep, and there's less pressure. Water goes into the discs from the vertebrae that are below and above the disc. The water goes in there, gets absorbed by this nuclear component. Then when you're upright during the course of the day, the compressive loads like this distribute the pressure of the inner part of the disc to the outer peripheral fibers. The problem is that as we age and acquire tears and degenerative changes to the inner part of the disc, which is where the degenerative process starts, these walls that contain the inner part become weaker. It's not uncommon by the time we're in our 40s to suffer herniations of this material out through tears that migrate initially from the inner part of the disc, which is, by the way, not felt because this inner part doesn't have a nerve supply. And over time, the outer part of the fibers become involved. Then this inner material can migrate through those tears over time to the outer part. They can then herniate outside the disc walls, and guess what lies behind there? The nerve roots, right behind. This is an example of a nerve root that would be behind the disc. So if this disc herniated out that way, it could pinch on that nerve root. Although more typically what happens is, as this disc degenerates and goes backwards, the nerve root that's affected is the one that's going to come down this canal and exit at this hole below. In any case, it's these degenerative changes to the disc that over time change the disc. That means that the disc over time will collapse, kind of like a sponge that's losing water content will collapse over time. That puts more pressure on the joints right here of the vertebrae. These joints then become deformed. Also, that changes these bones here so that they become deformed. If you take an MRI scan, you can see these changes. You can also see that there becomes a stasis or stagnation of the fluid that would normally migrate back and forth between the vertebrae and the discs. These bones then change color and become swollen and edematous. We call that those modic changes. So lots of changes happen, but their underpinning is the changes to the disc that again start as we're children and teenagers and progress throughout our lifetimes, reaching a peak incidence of herniation by the time we're in our 40s. Thereafter, concurrent with all those changes, there's generally a dehydrating process of the disc so that beyond our 40s, the incidence of disc herniation may reduce, but that gives rise to other complications as a result of the degenerative process. Things such as spinal stenosis or narrowing of the canal and the little holes or foramina where the nerves exit as a result of disc bulges, disc collapse, enlargement of the bones which grow in all directions to make the hole here smaller. I'm going to use another model to illustrate that point. This is supposed to represent an older model. If I turn it in front, this would be the front of the spine. This would be the back right here. From above it would look like that. But you can see from the front there's deformity of the bone as there's more pressure on it because of the disc not doing a good job because it's now degenerated. What's not depicted in this model is these bones in the back also enlarge, and when they do that, and I'll take the model apart for a moment so you can see it, when all of these bony components enlarge, then the hole here where the nerves would descend becomes smaller, and the holes on the side where the nerves would exit, they also become smaller because everything is collapsing. That means that you get pinching of nerves either from disc herniations, such as depicted in this little red lesion here, or you can get, and it's not shown here, there's a ligament that runs right across this area here. That often enlarges as part of the degenerative process. When that happens, that also makes the canal smaller. So this canal gets encroached upon more and more and more and more by ligamentous, bony, and disc-related degenerative changes. That makes less space for the nerves, and it raises the probability that the nerves will get pinched. Stenosis is a common expression you'll hear for people typically in their 50s and older. It's also true sometimes that the canal is smaller on a congenital basis, meaning when you were born, your canal didn't develop so that the hole is small to begin with. That means your threshold for stenosis-related symptoms and pain and pinching of nerves is lower, so you may acquire these symptoms at a younger age. I won't get into what happens there, but in short, sometimes this bone right here, this distance is shorter. This is the pedicle, meaning the connection between the vertebral body here and this posterior neural arch here. And if this bone is shorter, of course, that means this hole's going to be smaller this way. And that means that you start with a small canal to begin with. And then if you superimpose the acquired degenerative changes upon those congenital, that congenital status in some people, you get spinal stenosis-related symptoms at a younger age. In any case, it's these degenerative changes of the disc that start everything from happening. Now, my point in explaining the cause of neck and back pain is that if you understand that it's the degenerative process of the disc that gives rise to all these subsequent degenerative changes that eventually cause pinching of nerves and pain related to the joints, discs, and nerves, which are the three common pain generators in the spine, then it's easier for me to get you to understand conceptually that the most direct, effective, rational, logical, intuitive way to treat this process, and this has been validated in my 28 years clinical experience, is to make an effort to physically decompress the spine and the disc. The way you do that, and there's a great technology for this I've been using for the last 9 years now, is to place somebody like this on their back on a table. I secure their anatomy to the table. The table very slowly opens up and separates the vertebrae to get more water, oxygen, and nutrients into this. It initiates physiologic changes in the disc to increase the cells in the disc. The cells in the disc, when they're in a better environment from this mechanical process, will divide and make more cells, and those cells will start to make or synthesize more of the molecules to repair the disc. If you do this and you open this up over a series of treatments, you will get partial regeneration of the disc. It's validated in microscopic or histologic studies. The amount of repair of these molecules, the synthesis of these reparative molecules, has all been quantified. It is the most rational, effective way to treat this problem. It's a fantastic treatment. It is by far the most effective treatment I've used in 28 years. And the first 18 years of my clinical experience I spent in an orthopedic, physical medicine, and physical therapy practice. We didn't use this tool. The treatment I offer now is significantly more effective than any of the treatments I offered previous to this. I also spent 4 years in a neurosurgical practice learning surgical indications and procedures, so I know when surgery is indicated, and there is, thank God, the availability of surgery when it's indicated as well as injections, because sometimes they're a great adjunct or alternative to surgeries, and an adjunct sometimes to the treatment I provide in the way of spinal decompression. But if you understand that the cause of low back pain and neck pain is 98% of the time this slow degenerative progressive process that involves the discs and the subsequent changes in the rest of the anatomy of the spine, you'll understand conceptually why it's so effective to treat people with spinal decompression of the spine to get them better. If I can help you with your problem, please give me a call. It's 404-558-4015. I'm Dr. Castanet. I'm in Decatur, Georgia, and I service patients throughout Atlanta, Tucker, Decatur, and elsewhere throughout Georgia. Thank you very much for your time. Bye-bye.